Thank you very much, Mr. Chairman and my colleagues in the PTF team, distinguished ladies and gentlemen. Today is the 27th day of April 2020, and it marks 2 months since we recorded the first case of COVID-19 in Nigeria. That first case was on the 27th of February with the Italian index case. Since then, we've recorded 1,273 people in 32 states and the Federal Capital Territory that have been confirmed positive for COVID-19. The 91 latest infections are as follows: 43 in Lagos, 8 in Sokoto, 6 in Taraba, 5 each in Gombe and Kaduna, 3 each in Bauchi, Edo, Ondo, Oyo, Rivers, and FCT. 2 in Osun, and 1 each in Bayelsa, Ebonyi, and Kebbi. 239 persons have been successfully treated for COVID-19 and discharged home, but sadly, 40 deaths have been recorded so far. The rising number of cases is of concern to all, but there is evidence of increasing in-country community transmission, which to a large extent is as a result of non-compliance with lockdown orders and other non-medical interventions. Another presumptive source of exposure to infections is the unauthorized treatment of highly contagious COVID-19 patients in private homes or unaccredited health facilities, with risk of infecting their families, other patients, visitors, and health workers. These factors necessitated the ongoing active case-finding strategy with house-to-house and cluster testing, which has contributed to increased case detection. We have now activated 2 additional labs in the COVID-19 network. Usman Dan Fodio University Teaching Hospital, Sokoto, and Ahmadu Bello University, Zaria, bringing the total number of labs to 15. All states have been supplied with medical consumables to support preparedness and response activities. There are concerns about the steep rise in the number of persons diagnosed with COVID-19 in Kano State. You sadly included members of the State Emergency Operations Center, along with reports on a reported spike in the number of deaths over the weekend. The federal government, through the Federal Ministry of Health, is deploying a high-powered fact-finding delegation to work with the state to improve COVID-19 response, as well as ask questions on the causes of these deaths reported. However, His Excellency, the Governor of Kano State, Governor Ganduje, as well as the State Public Health Department, who will receive the delegation tomorrow, will brief the team as appropriate. While wishing all citizens well, particularly those who are presently observing Ramadan, I shall reiterate the usual public health advisories. Stay at home, avoid large gatherings, especially during iftar. Practice physical distancing by strictly maintaining a distance of at least 2 meters, that's about 6 feet, between people always. Use non-contact greetings such as waving, nodding, or placing a hand over your heart. The elderly and those with pre-existing medical conditions such as cardiovascular disease, diabetes, liver disease, kidney disease, chronic respiratory disease, and cancer should avoid receiving non-essential guests, especially at close quarters at this time. And of course, the use of masks or face coverings over your nose and mouth if you must leave your home is highly recommended. We are engaging traditional and religious leaders, other faith-based bodies, civil society organizations, and other sectors to further increase risk communication messages to communities. Arresting the spread of this virus requires our individual and collective effort. Finally, I would like to speak about calling for medical help. If you suspect or someone around you has been exposed to COVID-19, call the toll-free 112 number. There have been unfortunate reports of persons who suspect COVID-19 in critical condition, losing valuable time in trying to contact NCDC for a test. We are in the process of setting up an emergency ambulance response system to address such issues. If your symptoms are mild to moderate, you can afford to isolate at home while awaiting a test and the result of that test. However, if you are in medical distress, such as difficulty in breathing, and in need of urgent medical care, please call your state emergency number where available, or call the Federal Tertiary Health Institution nearest to you for help. In such cases, whether or not you have COVID-19, there is a need for prompt medical attention. You cannot afford to wait for a test result. Resources and real-time information on COVID-19 can be found on the social media handles of Federal Ministry of Health and NCDC. The Federal Ministry of Health website and the NCDC COVID-19 microsite covid19.ncdc.gov.ng. Before I quit this podium, you will recall that the chairman of this COVID, the Presidential Task Force, did ask that at appropriate time, you will be apprised of the measures that government is putting in place at the federal level to assist the health workers. So I will just read out briefly what these measures are. Hazard allowance. The federal government has agreed to shelve the payment of existing hazard allowance of 5,000 being paid across board to health workers hitherto. This is what had been in existence since 1991. In its place, a special COVID-19 hazard and inducement allowance of 50% of the consolidated basic salary is to be paid to all health workers in federal government teaching hospitals and federal medical centers and her designated COVID-19 centers and primary health care centers to last for the first 3 months in the first instance. B, 40% of the consolidated basic salary will be paid as special COVID-19 hazard and inducement allowance to health workers at special non-public hospitals and clinics in the federal ministries, departments, and agencies for the same 3 months period in the first instance. 20% of the consolidated basic salary will be paid as special risk allowance. Additionally, on the special COVID-19 hazard and inducement allowance to all health workers directly managing COVID-19 at the infectious disease hospitals, isolation, and treatment centers. D, 10% consolidated basic salary will be paid to non-core medical professionals working in health sector and operating at aforementioned hospital clinics as special allowance for COVID-19 period for the first 3 months. What we're saying here is that there are people who are not directly involved in patient care, whether at the isolation centers or the treatment centers, but they still work in an environment that puts them at risk. That it will only be fair to consider these people as well and encourage them one way or the other. Number 2 here is insurance. There is a group life insurance and employee compensation. The health workers noted that the federal government has paid and activated group life insurance for all categories of workers in the public service with 13 insurance companies, but urged the federal government to ensure full payment for the cover to last for 1 year. The federal government of Nigeria is urged also to fully reactivate the insurance policy for employees under the Employees Compensation Act to cover for infirmities, critical illnesses, disability, and death in the course of managing COVID-19 cases. These 2 insurance covers, which are for all federal public servants, especially the health workers for COVID-19, and post-COVID-19 period for the next 1 year, is guaranteed. The Presidential Task Force on COVID-19 has been requested to provide additional insurance cover aside the above listed for frontline health workers at infectious disease hospital, isolation and treatment centers. Just a bit of explanation here. What is being said here is that something can also be done by way of insurance by PTF, because what I read out earlier is what the federal government is doing in line with the service protocol, if you like. In addition, the Presidential Task Force is urged to dedicate all the life insurance donations to volunteers and National Youth Service Corps health workers. Now, what is meant here is that the groups that I mentioned earlier on, they are civil servants in the federal civil service. But there are people who are volunteers and have been called out, either retired or just volunteering on their own, who are not covered within the civil service scheme. and youth corpers as well, who are not covered within that scheme. But the chairman did announce here some time ago that some insurance companies, they came together to donate certain insurance covers to the PTF. So what is being said here is that these insurance covers will be for such people who are not captured within the Federal Civil Service scheme. Then the issue of retirement, review of retirement age for health professionals. The request for retirement of health workers to be moved up to 65 years and that of medical doctors, consultants to 70 years was discussed. I will let you know who discussed this. The government agreed to look into this post-COVID-19. However, in the interim, government agrees to grant extension of service for a period of 3 months in the first instance for health workers retiring within the COVID-19 period. So what is being said here is that if somebody is due for retirement and is a health worker, this is not the best time to let that person leave when we are battling. It's like a war period. That is not the best time to lay people off work or to allow them to go, if they so wish to be part of the rescue effort. This extension period for 3 months in the first instance will not count as pensionable period of service. And number 4 is tax rebate. Government agrees to a tax waiver on special COVID-19 hazard allowance and will consider same for call duty, specialists, and shift duty allowances for 3 months in the first instance during the COVID-19 period. What this means is that we won't want to create a situation where you give something with the right hand and you take it back, with the left hand. That these allowances would not be taxed. That's what is being said here. Then personal protective equipment that the federal government through the PTF and Nigeria Center for Disease Control agrees to scale up the provision of PPEs to all health workers in the federal tertiary institutions and extend same support to state governments in order to protect health workers. Of course, we do know that even the insurance companies will insist that PPEs are given to all health workers. It's a kind of precondition. And finally, is to say that the federal government agrees to bring all these measures of motivation of health workers to the attention of all subnational governments for their guidance, information, and necessary action. Now, I did say earlier on that you will know who this we. This meeting, where we agreed to all these terms as stated, was attended by the Honorable Minister of Labor and Employment, Dr. Chris Ngige, myself, Minister of State for Health, the Acting Chairman of National Salaries and Income Wages Commission, the President of the Nigerian Medical Association, Dr. Francis Faduile, the Deputy President of Pharmaceutical Society of Nigeria, represented by pharmacist Mune Elelu, and the General Secretary of the National Association of Nurses and Midwives, represented by T.A. Shetima, and the National Chairman of Juhesu, Bubelimoye Joy Josiah. So we sat down to discuss these things, and we agreed. We agreed through this MOU, signed on to by all the appropriate officials, and of course ratified by the PTF as a body. And I was privileged to have been the one saddled with that assignment. Thank you very much.